All right, so thank you all for joining us. We are so excited to share this time with you and to share this presentation with you as well. If we can go to the next slide, please. So before we begin, I'd like to note that the views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Next slide, please. My name is Mackenzie Simmons, and I have the privilege of serving as the project manager for SAMHSA's 988 Crisis Systems Response Training and Technical Assistance Center that's operated by Altarum. Now, we wanted to take a moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of this webinar. As you can see, closed captioning is enabled for today's webinar, and if you need tech support, please reach out by using the Q&A function and we'll address it for you. Lastly, if you have questions for the presenters during the presentation, please enter them into the Q&A area and we'll address them as time allows after the presentations or during office hours. Next slide, please. Today's webinar is the 5th session of 6 in a series of webinars called Connecting to Serve Promising Practices for 988 and 911 Collaboration. After attending this webinar, attendees should be able to review and comprehend standard operating definitions of several key terms, such as risk, liability, and qualified immunity, explore barriers and considerations that assisted in developing 988 and 911 interoperability, and provide a working knowledge of navigating conversations surrounding risk and liability as it pertains to 988 and 911. Next slide, please. Before we start our presentation portion, I'd like to introduce Tiffany Russell. Tiffany serves as the Chief of Crisis and Justice Initiatives with SAMHSA's 988 and Behavioral Health Crisis Coordinating Office, as an advisor to the 988 Director and other members of SAMHSA's senior leadership in planning and determining policy, programs, and activities that address complex challenges in coordination of 988 crisis centers with law enforcement, 911 call centers, and emergency medical service providers. She also develops, recommends, and implements programs and provisions of guidance related to improving crisis response and equitable access to services for individuals with behavioral health needs that minimize unnecessary law enforcement involvement and promotes diversion from the justice system. At this time, I will hand things over to her for a brief welcome and to introduce our guest speakers.
Thank you so much, Mackenzie, and good afternoon, everyone. We are so excited that you have joined us and are thrilled to have your participation. Now, before we move forward with introducing our speakers, I want to thank SAMHSA's leadership for the continued support of this initiative and the transformation of the behavioral health crisis system. So thank you to our Assistant Secretary, Dr. Delphine Rittman, and her executive leadership team, as well as our Director of 988 and Behavioral Health Crisis Coordinating Office, Monica Johnson, Deputy Director John Palmieri, Division Directors James Wright and Jill Mays, and Senior Advisor Richard McKeon, as well as each member of the 988 team. I also want to thank our partners, NHTSA and the National 911 Office, as well as Vibrant Emotional Health, particularly Amanda Miller, the Director of Crisis Continuum, for not only their partnership in this episode, but the entire series. Today's episode has been long awaited and our most requested. We wanted to ensure that we provided you with sufficient coverage of this subject, so this is one of a two-part series. Today's episode will build on the foundation of how to discuss risk and liability when considering or implementing the transfer of behavioral health calls, crisis calls, from 911 to a 988 network center or crisis hotline. In this episode, we will spend more time focused on, in our next episode, we will spend more time focused on the real life application, as well as the challenges and opportunities that take place when collaborating with community partners on alternative responses. We hope that the information you receive from these episodes will encourage deeper engagement and confidence in working through the intricacies of 988 and 911 collaboration. Finally, before we get to the introduction of today's panel of speakers, We hope that you have felt heard in your numerous requests for this specific topic, as well as on other concepts that we have discussed throughout this series. The 988 Behavioral Health Crisis Coordinating Office is committed in not only providing information through this webinar series, as well as through one-on-one technical assistance through our Crisis Response Technical Assistance Center, but also through additional guidance documents and toolkits that we currently have in development. We're going to thank you in advance for your patience and know that we are working diligently to provide you with resources to supplement you in this work. Now let's get to the introduction of our speakers today. Ernie Stevens is a former police officer for 28 years, serving 26 of those years with the San Antonio Police Department, where he was a founding member of the Mental Health Unit. He continues to assist law enforcement agencies around the nation by providing technical assistance and best practices approaches to mental health crisis calls. Ernie currently serves as the Deputy Director of Law Enforcement for the Council of State Governments Justice Center, where he works closely with the Department of Justice to assist agencies across the nation develop and strengthen their crisis response models. Next, we have Sophia Hernandez, who serves as the Deputy City Attorney for the City of Durham. Her portfolio is predominantly focused on public safety and code enforcement departments. She serves as General Counsel to the Durham Fire Department, Neighborhood Improvement Services, Emergency Communications, and Inspections. She has served as General Counsel to the Community Safety Department since the launch of its first response team in June of 2022. In addition to her work, she serves as the chair of the Alternatives to Policing Work Group of the International Municipal Lawyers Association. Our last panelist is Andrew Dameron, who serves as the Director of 911 for the City and County of Denver. A Denver area native, Andrew has led emergency communications teams in a wide variety of fields, including 911, healthcare, and the U.S. Department of Homeland Security. Andrew is an inaugural member of the Council of State Governments Expanding First Response Commission, where he works to educate national and international stakeholders and advocate for the dispatch of trauma-informed and community-based response programs through 911. With that, I will pass things over to Ernie to get us started.
Thank you, Ms. Tiffany. I appreciate it. It is an honor to be here today. So thank you to SAMHSA for inviting me. It is a humbling experience. And good afternoon, and thank you for joining us today to discuss 988 and the opportunities that 988 brings to both law enforcement and the community. So I'd first like to start out really by using an analogy when it comes to 988. You know, would you expect an electrician to repair your leaking sink, or would you just never think to have a veterinarian fix your broken leg? You know, of course you wouldn't. Yet in cities across the United States, law enforcement officers are often called upon to respond to a wide range of situations, whether they are best suited to address them or not. I think one of my favorite calls that I would receive on patrol is when somebody would find a snake in their house and they would send the police, right? So we're going to talk today about sending the right response to the right situation. I've spent more than 30 years working to improve police practices, first as an officer with the San Antonio Police Department, and now as the Deputy Division Director of Law Enforcement at the Council of State Governments Justice Center. So I understand firsthand how this plays out. For far too long, Americans have relied on law enforcement to be the first responders to crises, with few options for supporting people in need, and too many instances of police encounters with people in crisis result in tragedy rather than connections and needed services. And I saw this firsthand as I went through the crisis intervention training with San Antonio. But now, with 988, we have another option. The 988 Suicide and Crisis Lifeline, which became a nationwide service in July of 2022, offers people a direct connection to trained crisis counselors via phone, text, and chat. By matching people in crisis with the most appropriate response they require, 988 has the potential to transform the way we approach policing across the country, freeing up officers to focus on crucial police work, such as responding to violent incidents. And I'm going to talk a little bit more about that later. But furthermore, as it grows, 988 can reduce the police burden of handling mental health calls that busy or understaffed departments often face. With the right support, 988 can be an alternative response that communities have been asking for. Now, from anywhere in the country, 988 counselors can de-escalate and connect people to services and treatment, including the national resources that local law enforcement may not be aware of. These call takers also bring expertise in responding to mental health needs of children and young people, and have the training and technology to be a resource to rural and under-resourced communities. Additionally, because many crises can be handled over the phone, 988 is a powerful tool to avoid the escalation that can occur when a uniformed officer is involved. This increases the safety for both the community members and the responding officers. And I would say this, and I would say this a lot in my discussion with officers about responding to mental health calls, is that when law enforcement responds to a mental health call, no matter what, there's always going to be a weapon involved. And that what I'm talking about is the officer's sidearm. So we have to make sure that we're sending the least restrictive approach to a crisis situation. Transformation on this scale is never easy. Trust me, I know. Like countless officers across our great nation, I've spent years trying to serve the communities I've worked in to the best of my capabilities. But now, more than ever, law enforcement agencies must step up and say that they cannot and they should not be the default option for every mental health crisis call. In recent years, many law enforcement agencies have risen to the challenge of partnering with behavioral health providers to better respond to people in mental health needs. This includes crisis intervention training and co-responder teams that the Council State Government's Justice Center has helped support in partnership with the Bureau of Justice Assistance. BJA is a component of the U.S. Department of Justice Office and Justice Programs for the past 20 years. While these are great steps forward, too often people are still dialing 911 for emergencies that are better suited for other professionals. Now, I believe Nationwide 988 Lifeline makes this transformation possible on a scale that we've never seen before. In collaboration with SAMHSA, BJA, we at the CSG Justice Center are prepared to support local efforts to include coordination between law enforcement and 988 partners, just as we have provided guidance through the National Peer Network of Law Enforcement Mental Health Learning Sites. We are now working with law enforcement groups and criminal justice, behavioral health, and community partners to support a new vision of coordinated public safety crisis systems. But we cannot do this work alone. It will take a collective action to make this shared vision a reality. Law enforcement's embrace of this new approach to crisis response and its ongoing collaboration with behavioral health partners will be key to the success of the 988 transition. As someone who knows the need for 988 firsthand, I urge law enforcement leaders and all officers to act without further delay. Now is the time for us to rise to the occasion in a new way as a core partner in the solution that communities and officers have been asking for, ensuring that every caller gets the right response to address their needs. For the well-being of every officer and community member in crisis, let's do this work together to adopt, employ, and wholeheartedly champion 988 right now. It is ready, it is cost-free, and it will bring about the change that we vitally need. As I discussed earlier, and I touched on the topic of staffing and recruiting, I feel that 988 right now is so vitally important to law enforcement on many levels. When we look at staffing for law enforcement across the nation, almost every agency, organization that we speak to, that we try to uplift or upstart a program, has staffing needs. So 988, what this will do is help relieve some of the strain that happens on the 911 system in responding to low-level mental health calls or calls for social determinants of needs. This is a collaborative approach. This is something that's going to benefit both the community and law enforcement. As law enforcement agencies partner with 988, I also feel that this is going to send a message to the community. And it's saying that law enforcement is going to redefine what safety is, right? It's no longer going to be measured by the absence of crime. Instead, it's going to be focused on the well-being of the community. And I think that sends an important message when you see this collaboration and this kind of effort for the community. Just recently, in fact, yesterday, I was in New Orleans at the International Association of Campus Law Enforcement Administrators Conference, and I spoke about 988. And here at the Justice Center, we just printed over 10,000 pocket cards for distribution for law enforcement agencies to send out to NAMI affiliates. So at the end of this presentation, if you would like some pocket cards, it's just a one card that has information about what 988 is with a link to SAMHSA's website, as well as when to call 911 versus 988. I think it's an important resource. It's something that is very easy and attainable to get to your agency, and I'll be happy to send those out upon request. Some of the other features that I've seen law enforcement agencies do to collaborate with their 988 partners is placing the 988 decals on the police cars and put in parentheses for mental health assistance. So there's nothing like an outside the box thinking of marketing when you're trying to figure out how can we get the message out about 988, because everybody looks at that police car when it pulls up next to you. I promise you do. Now, when it comes to law enforcement, we truly don't know what we don't know. And I think that's been something in law enforcement that we have struggled with for a long time. We are very good at what we do when it comes to law enforcement, but when it's outside our purview, we stay siloed in what we're really good at. For years, you hear about what happens if we send counselors out. I'm going to let Mr. Andrew talk about this in a little bit. I heard the pushback from law enforcement. If you use 988, if you put clinicians in vehicles, if you send these clinicians out without law enforcement, there's going to be all these injuries to clinicians. But I beg to differ. In working in San Antonio with our local mental health authority, the mobile crisis outreach team had been responding to calls in the community without law enforcement for over 30 years. And I promise you, we were not reading about clinicians being injured or hurt on a daily basis. In fact, they do a remarkable job. They're the right individual to send to a crisis response. Just recently, CIT International put out a memo about sending a health response. And I want to talk to you for just a little bit about the new guidance that the Department of Justice put out in May of 2023. And I think we're going to put a link in to the CIT International memo that they put out about a health response, as they continue to support the idea that mental health crises are not just a community issue as a whole, right? But a behavioral health issue that should be dealt with as a health response, which leads me to my next point. The Department of Justice in May of 2023 put out some new guidance about a health response and what that needs to look like as they partnered with the American Disabilities Act. And I'll sum it up basic for you, but I think the conversation will continue as we move forward with this webinar. But the Department of Justice basically said, if you call for a health response, let's just use an example, a heart attack, the response you're going to get is a health response. You're going to get an ambulance and a paramedic's going to show up, right? There's no difference when somebody's calling in a health response in a mental health crisis. The DOJ and ADA has put out guidance that this demands a health response, not just sending a law enforcement officer out, but having either access to a clinician or access to someone who's better suited, who's better trained to help with this crisis, which leads me back to the importance of 988. For law enforcement PSAP centers, public safety answering point centers, to coordinate and work closely with their 988 call centers, what law enforcement agency is able to do now is identify these calls, as long as there's not a high acuity for danger or I guess a significant amount of a disturbance that may be taking place. A good transfer call can go to 988, and now you have your health response, because now that call is going to be flagged by a qualified and trained clinician who will be able to triage that call and hopefully be able to resolve that, as we have seen that 98% of the calls that come into 988 are resolved over the phone. So again, I implore you, if you're a law enforcement leader or you're on this webinar and you don't know that much about 988 or how the collaboration efforts work, I ask that you reach out. I ask that you ask requests for the 988 cards and continue to watch this series as part 2 comes up here in the following weeks, so we can discuss further about risk and liability and implementation of these services. I thank you for your time this afternoon, and Miss Olivia, I'll turn it back to you.
Thanks so much, Ernie. And now we'll bring up Sophia.
Hi, everyone. Again, thank you so much for having me here. I'm really excited to be part of the series, which, gosh, I wish I had been from the beginning. I wanted to start with a little bit about me. Throwing out the disclaimer that I am not a mental health provider, nor do I have the boots on the ground experience of the gentleman on the panel. And of course, so everything I say, I want to remind you that you know more what you do than I possibly could, right? I'm a lawyer, which doesn't really make me popular. So again, thanks for the invite. It's nice to be included. Over the last 6 years, I've had the honor of working with most of the public safety departments in Durham, which is a city in North Carolina, for those of you who don't know. Our population is around 350,000. I'm not here to give, unfortunately, clear-cut answers, and that's because it would be irresponsible for me to do so. I don't know your local nor state laws. I don't know your departmental policies, right? Nor am I employed by your state or your jurisdiction. What my hope is to lay down some foundational knowledge and explain a bit about my personal thought process when I'm encountering these questions for my jurisdiction, again, which is the city of Durham. To give you, again, a little bit more background here, the departments that I advise. So I advise our fire department, which is about 450 employees. All of our firefighters are also EMTs, and we end up responding to more EMS calls than the rest of the EMS community system in our county system. So we do see a lot of crisis calls through the fire department. I also represent our emergency communication center, right? Our 911 call center, and we average about 20,000 calls per month this year, which is actually a bit of a decrease of the last 2 years. And so I'm thinking maybe that's also with more 988 being out there, folks having an increased knowledge. We're seeing, I think within the first year of 988, we saw about a 30% increase in folks calling. So, I'd like to think that that 988 has led to that decrease because more folks are going to 988. And then I also represent our community safety department, which launched about 2 years ago. And the aim of that department was a lot of what Ernie was talking about, right? Connecting people who are experiencing non-violent mental health crises or quality of life concerns to the right care. And so we have 4 different programs. We have crisis call diversion, which actually has a mental health clinician embedded in our 911 call center. And I think that this is the most relevant to this conversation, that we already are doing that. And we're thinking about how do we make this more efficient by working with 988. We also have a community response team, which dispatches 3 unarmed persons, which includes an EMT, a clinician, and a peer support specialist. We have care navigation, which follows up with any folks who encounter one of our services to make sure they're getting connected to community-based care that they need and want. And then we do have co-response for those certain calls like domestic violence that can pose a greater potential of safety risk. So our department, our community safety department, started again 2 years ago, and it launched with a handful of folks. We're now at over 50 people, and we're citywide 12 to 15 hours a day. We hope to go 24 hours a day this next fiscal year. So that's kind of all the things that I encounter through my work, is advising a lot of different first responder entities and how to best navigate this landscape. Before diving into the topics of risk and liability, I did want to note a little bit, again, back to my experience from the 6 years that I've been working with the city of Durham. I find that departments are a bit reticent to bring in the attorneys, and I get it, we're not popular. But, you know, when we're brought in later in the process, right? Let's say you're thinking about 988 and 911 interoperability, what things you can do with your jurisdiction or your entity. If we're brought in much later into the conversation, when a lot of work has already been done and conversations have been had that we should have been a part of, well, you know, it's our job to ask questions and to want to look things over, which departments can feel like that we're creating obstacles and slowing things down, which of course then doesn't bode well for the relationship. So my suggestions to my departments is to discuss things early with me, right? I appreciate when my departments understand that there are legal risks and liabilities to consider. I appreciate it when I'm given the full context of why this matters, right? So there's a lot of demand on my time, like I'm sure all of yours, and certainly for my departmental clients. So it helps me understand, why is this a priority? I like to know that my departments have a strong basis to believe that this will somehow better serve our community. And again, that goes to a lot of what Ernie was saying, right? Of sending the right folks to meet the needs of our residents. So I would advise folks out there to work on building that relationship with your attorney, so you're not just at the very end or near the end of when you want to make something happen, asking them to simply review a contract or something like that. I think if you get them involved early, you might be able to avoid a no later on if they're invested into the program or initiative you're trying to launch. And certainly if you have qualitative or quantitative data that sort of shows why this makes more sense than others, like that DOJ study that has been done, or DOJ's different consent decrees in Minneapolis and Louisville, I believe, those can help bolster why this makes sense. All right, so going into the 3 topics that we wanted to address today. Risk, right? And risk is just the possibility, the risk of facing legal action for perhaps non-compliance of the law. And right, we live in a very litigious country. As I tell my clients, anyone can sue. So the fact that we may get sued doesn't necessarily, to me, cause me a lot of trouble, because yeah, anyone can sue. The issue, and it doesn't mean just because we get sued that we did something wrong, or that the person suing us somehow has a strong case. However, right, we have to understand, when we're thinking about risk, getting sued looks bad in the press. Getting sued costs money. Getting sued can be scary, maybe not to a lawyer, but to the administrators or the elected officials who don't want it on the paper or on their record that somehow a decision that they recently made to start this program or this initiative is causing the taxpayers' dollars. And so we have to understand risk as this very large concept, that it's about an assessment of all the legal issues at play. It includes an assessment of the political climate. And to me, it includes obviously a look at past cases that have dealt with this issue. It includes the cost of litigation. It includes whether we have insurance that could possibly cover the new thing we're trying to do. And it should include the repercussions or consequences of, well, what if we do get sued and we lose? Then now we know very certainly that we're limited from doing this. And does that create bad precedent, not only for us, but other jurisdictions in our state? So when we think about risk, it is why for lawyers, there's no clear-cut issue because there's a lot to consider. So what may seem like, let's say, you're wanting to start a coordinated mental health response program in Seattle. That's going to be a very different risk assessment than if you're maybe trying to do that in Norman, Oklahoma. And not picking on Norman, Oklahoma, I hear it's a very lovely town, but those are very different jurisdictions, right? Washington is a home rule state, which kind of gives a wide breadth of authority to its towns and cities. Oklahoma is a Dillon's rule state, which is a much more limited breadth of authority for towns and cities. Washington obviously has a much more liberal political climate. Oklahoma is more conservative. Seattle has a long history of programs in place that have already been addressing these issues. That's not necessarily the case with Norman. So it could be the very same program, but depending on where you are, political climate, and a lot of these other factors, you may end up by doing this risk analysis, deciding different things for the exact same program based on Seattle or Norman. So again, risk is a very multifaceted discussion that needs to happen with your department, with your attorney, and the greater administration, and ultimately, of course, the elected officials. And anytime you're doing something new, it likely means that someone in your jurisdiction hasn't already done this analysis, and it's risky to be the first. And if you have cautious administrators or elected officials, they may not want to try simply because they don't know if it would pass legal challenge, or how the media will respond, or if the public will like the services. And it's risky when we're working on these issues in particular, because as we know, the law has not caught up yet, right? There's not a lot of statutes and laws on the books that deal with alternative response, that deal with interoperability of 911 and 988, or dispatching through 988. And so that makes, our lawyer brains a little more freaked out, because there isn't a law that we can point to that says, yes, you can, or no, you can't. We're having to draw some analogies to other related topics. So for example, if you have no state or local law that deals exactly with, 988 being sort of connected to a local jurisdiction, your attorney may need to look at laws relating to PSAPs only and PSAP dispatchers and analogize, okay, well, how would the law treat 988 dispatchers? I always suggest start by looking at neighboring jurisdictions or similar jurisdictions when I'm trying to make a risk assessment, right? When I get the question about something new in Durham, I look to see, has Charlotte done this? Has Raleigh done this? And I look there because I think if they are doing it, it likely means that one of their attorneys has given them a thumbs up on it. So I call that attorney, I ask about their thoughts, their process. We usually have a dialogue. And I learn a lot from my local government colleagues, like I'm sure you all do with your counterparts in other jurisdictions. So looking at other places can often be a great start for whether we feel that this is something we can pursue or not. I wanted to give an example of this. So as Ernie mentioned as well, right, a lot of police departments across the country are faced with vacancies. And so here in North Carolina, some jurisdictions wanted to create what were called civilian crash investigators for a response to no injury crashes. And so we thought, okay, we don't have a lot of police and police are feeling really inundated. We do have these crashes that happen that require a police report. Can we somehow create civilian positions to send those guys to the crash investigators and thereby free up police time? That made a lot of sense to us. It felt like very creative problem solving. Like I said, several jurisdictions in North Carolina wanted to do that. It also made sense to us, if we had these vacancies living in the police department, could we not reclassify some of those police vacancies for these roles, right? No, our General Assembly very quickly issued a law that said, hey, you can have civilian crash investigators, but you cannot reallocate funds from the police department to having these positions. Done. So that answer was, or that question was answered in North Carolina. Now, say you live in South Carolina and you're wanting to do civilian crash investigators in your town. Your lawyer may be very interested to see what happened in North Carolina and likely advise you that, yes, we don't know exactly what would happen in South Carolina, but because North Carolina is such a similar jurisdiction, we're going to go to be cautious by what their legislators said. So again, learning from our neighboring jurisdictions is a big part too of how we analyze risk, even though it's not an 100% analysis, it's a risk assessment, right? There is no certainty to calculate. All right, moving over to liability. So unlike risk, liability means that you actually have been, that the court or a law specifically holds you or your entity responsible for an action, right? And what in this field, liability is a lot about what case law has decided, what judges and juries have decided, because again, the law hasn't caught up. There's not, that I have seen ever, like a law that says dispatchers are liable for misrouting a call, right? There's nothing like that on the books. So we're looking at when someone has sued for a specific reason and a court or a jury found, yes, they should be liable. Then we use that case to try to draw analogy from it and be like, well, in this situation, that's similar. So yeah, we probably would be held liable. Again, this is why lawyers go to school for a long time, because we're doing a lot of interpretation and extrapolating from things that are similar to try to create an assessment of what it would be now. So, you know, generally generally there's not a lot of specific state laws on this. And at least that's for me for North Carolina. And I have looked at other states, again, because the law hasn't caught up, because, you know, fingers crossed, there hasn't been a lot of suits filed towards 988 dispatchers or even 911 dispatchers. There's not a lot out there that says, yes, there's liability, or no, there's no liability. And that makes sense to me, right? The policy behind not wanting to sue folks that are first responders, or also the law being like, well, we're going to give them wide breadth, is because we want first responders to be able to do their job and do it well without the fear of, well, what if I get sued? So the law does insulate them from liability. Of course, we do have to worry about when we're dealing with gross negligence or maliciousness. So if a call taker is acting in some sort of malicious or grossly negligent way, they can be held liable under civil law. And I think that makes sense, right? We're talking about crisis call takers. We would assume that anyone taking on that role understands the importance of the work, and that, yes, if they act in a way that's malicious or without any care of the harm that they can cause, that they could be legally liable. And again, that liability would be through a civil suit, not necessarily criminal. And even that liability would be if they got sued, if the court or jury decided that they were liable. So there's no way to know always what a judge or jury would decide. So even then, that's not a very certain thing that you would absolutely be liable, because it would be up to a jury to decide whether the very specific action was in fact grossly negligent or malicious. So from my review, again, back to my personal experience with my jurisdiction, if my jurisdiction decides to pursue this interoperability between 988 and 911, there's nothing that immediately, to me, increases our call takers, dispatchers, or response teams' liability. It's really the work that we are already doing it. It's just now pursuing a new partnership to do it, so that we can expand who we're serving and hopefully better meet the needs of our residents. As to immunity, I wanted to lay out that there are a lot of different types of immunity under the law that we're talking about, right? There's what we call sovereign immunity, which is the federal or state governments have immunity for certain things. There's governmental immunity, which usually applies to local governments or tribal governments. There's public official immunity, which usually applies to legislators and judges. And then there's qualified immunity, or what other places, I think it's called different in other places, but it's, again, qualified immunity generally is that lower level, which applies to the individual people who work for local government. But again, this is one of those places that I say it depends on your local and state laws. So for North Carolina, qualified immunity applies only to public officials, not public employees. And there's a pretty distinct definition of what makes you a public official versus a public employee. And so, you would need to spend some time looking at that, because not every employee is necessarily given public qualified immunity. It would be if you are a public official in particular. So talk to your attorney and do so early on that issue. There's also going to be case law within your state that might have already decided specific categories that are not public officials. So again, in North Carolina, EMTs and social workers are not public officials, and so they don't have qualified immunity. Nevertheless, the city of Durham has its own policy that says we're going to defend our employees unless they're acting maliciously. The last thing I wanted to cover is to talk about contracts generally, right? We've just spent a lot of time talking about why this seems like a really good idea, what could be a risk or liability assessment regarding these, and what immunities might be in place. But as an attorney, I certainly encourage folks to think about contracts as a useful tool to mitigate risk and liability, right? And two particular contracts that I would point to are insurance policies, right? Those are contracts that we enter into with the insurance company. So here in Durham, when we launched new response units, and we were now for the first time employing social workers and peer support specialists, we sat down with our finance folks that in the risk management division, and we reviewed our current insurance policies. We wanted to know, are we covered for this new thing that we're going to do? Do we need new or increased coverage, right? So that is a way that even if we say, yeah, this is carrying some risk, can we mitigate our risk by, entering into other additional coverage for insurance? The other great way that we mitigate our risks is through the contractual relationships we have with these entities. So here we're looking at doing transport, non-police transport for involuntary commitments, right? So we're looking at that as a contract, and how can we, between our partner agencies, the hospital, PD, us, enter into a contract that allocates risk and liability in a way that makes sense for all the partners involved. And so those contracts would, talk about who's responsible for what happens if someone doesn't meet that responsibility, and what indemnification or other coverage could there be in the contract that makes everyone else feel comfortable and on board. And I think that is all that I had for you today.
Thank you so much, Sophia. And for our last panelist, Andrew.
Well, good, morning for me, afternoon probably for a lot of you. My name is Andrew Dameron. I am the director of Denver 911. And I am similarly very honored and humbled to get to talk about some of this with all of you from the kind of the perspective of 911 professionals trying to move the needle on a lot of stuff that 988 represents, what SAMHSA is working toward, what the Council of State Governments is working toward. And that is kind of redefining what it means to get someone help when they call and ask for it. So I will provide a similar caveat that I am also, I am not a legal expert. And so if I talk about risk or liability, it is not coming from any sort of legal expertise, but more kind of from the squishy feeling of what it means to kind of try to operationally make some of these changes and adjustments. Also, to kind of set the table, Denver has a couple of different programs that play into this. We do have a statewide 988 provider. But in Denver specifically, we also have the City Star program, where we have clinicians paired with paramedics or EMTs that we can dispatch directly to calls that come through Denver 911. We also have a co-responder program, and we have partnerships with various other entities that I'll talk about in a minute that have kind of increased the options available to the 911 team on how we connect somebody with help. So from a 911 perspective, for anyone who is not intimately familiar, risk and liability really kind of comes in two primary categories. The first is the advice and instruction that we give over the phone. What we know from experience and just from social science is that individuals experiencing a traumatic or scary experience, your primordial brain kind of kicks in, and you're not necessarily in a position to think clearly, and you can be very susceptible to influence. So we have to be very careful when we're dealing with emergencies, not to ask leading questions, to follow protocols that are strictly laid out. Medical calls, for example, we have medical triage protocols that are developed by a third party. They are signed off on by a medical director. And we have a robust quality assurance program where we have full-time employees who are reviewing those calls, providing feedback to the 911 call takers in this kind of constant performance improvement environment, so that we are, being good stewards of that responsibility. The second, and what's really applicable to the conversation today category, is the decision making that goes into what do we do with that call after we have it. And it's worth kind of looking back and recognizing that in 911 in particular, we've been around for going on 60 years. And it's only relatively recently that we've had an option other than a police car, a fire truck, or an ambulance. And I think Ernie touched on this earlier very well, that calls that need a fire truck or an ambulance, that's relatively self-explanatory. And so the cops were left over and they became the catch-all. We asked them for the last several decades to be all things to all people. And they didn't ask for this, but from a 911 perspective, it was, well, okay, it doesn't make sense to send the fire department or an ambulance, so let's send the police. And I think we wound up with something of a chicken and an egg situation, where when we received calls where there was a behavioral health or mental health nexus, the option that we had was police. And so this association sort of came into being of, well, these calls need police. They're potentially dangerous, and therefore we need to send police. We're sending police because they're potentially dangerous. And that kind of became the narrative. Now we're in a position where we have 988, a national partner to whom we can connect folks to more appropriate support services. We have programs like HEART in Durham, STAR here in Denver, where we can dispatch a clinician who is not wearing a bulletproof vest, who isn't carrying a weapon, but who has the experience and the knowledge to support that person through that behavioral health or mental health crisis. And all of this is happening with those decades of historical backdrop but these have always been police calls. And so what we have had to do here in Denver is take a very concentrated and deliberate approach to unspooling that cultural norm that exists, that these calls need law enforcement. We have developed policy and procedure in order to support that. We have also done a fairly good job of including our city attorney early and often. I'll give an example of the kind of that shift as it's occurred in Denver. So one of the things that came out of our shop. So early on, when the STAR program was relatively new, we got a call from an individual, a father, who said, my daughter has a mental health diagnosis. She is in crisis right now. Her mother and I are trying to get her to take her medication, but she's refusing. We would really like a STAR clinician to come out and talk to her and see if they can convince her to get on her meds. She is not a danger to herself. She is not a danger to anyone else. and we really don't want an ambulance to come, because the last time this happened, we called 911, an ambulance showed up, and our daughter wound up on a mental health hold, and she backslid in her progress working through her diagnosis. Well, we didn't have the right policies and procedures in place. We were operating off of that worst case scenario mindset, and the call was put up as a psych call, which at that time had a mandatory dispatch of an ambulance, and this poor girl wound up on another mental health hold. And so it was situations like that where we realized we've got to reassess what we're doing when it comes to these calls. 911, we've done a fantastic job of training our call takers and our dispatchers to be thinking about the worst case scenario, to approach every call with a healthy bit of skepticism and just assume that this is a life or death emergency, right? Because that's what we have to do. If you're calling 911, we need to assume that you have a life or death emergency. And as Ernie also mentioned, we get a lot of calls through the 911 system that are not life or death emergencies, that need a trauma-informed clinical approach in order to support somebody in crisis. And so we started looking at our policy and procedure and tweaking it so that we were creating space for the alternative options that we had. And so it's not just STAR, right? We built policy and procedure for a partnership with 211 in Denver, which is run by Mile High United Way. If we get a call from somebody who's seeking rental assistance or has food insecurity, we can connect them with Mile High United Way, and they can connect them with services that we don't even know exist. We have a partnership with 988 where we have, usually first party callers who call. They need to talk to somebody, and we know we have that resource available to us. But even there, that conversation of risk and liability comes into play. If this person is suicidal and they have a weapon and a plan, are we meeting that person's needs by connecting them to 988, or are they better served by getting a response to where they are right now because they're in imminent crisis? Those are the kind of conversations that we had to have with our city attorney's office to make sure that we are not just protecting the agency, but protecting our residents and our callers who are seeking help. So one of the first things that we brought the city attorney's office in on was inspired by that medical call that I mentioned earlier. And we wanted to create space for STAR eligible calls to get a STAR or nothing response. The idea being, if you had a bank robbery and for whatever reason there were no cops available to respond, you're not going to send the fire department, because what are they going to do? So we wanted to kind of create a similar mindset baked into our policy and procedure. And so we created a STAR or nothing policy where if a call is eligible for a STAR response, which by its very nature, it has to be non-emergent. There is no physical threat, there's no criminal activity, there's no brandishing of a weapon. And the caller states that if STAR isn't available, they don't want police, they don't want an ambulance. We manage those expectations on the front end. We let them know, hey, STAR is a limited resource. It is not as built out as we would like it to be. And that means that it could be several hours before a STAR van is available, or it could mean, depending on the time of day, that nobody shows up at all. Are you okay with that? And if they say yes, then we put it up as a STAR or nothing. For 911, that was a difficult shift. We are not used to getting information and not immediately doing something with it. Traditionally, our job is to send you help. Even if it's not the best response, we're going to send you the second or third or even fourth best, because we're going to do something with that information. And so to kind of change our mindset to the best response is a non-public safety response, right? Non-law enforcement, non-EMS. And we are okay, and our residents are okay with us sitting in that space of that could mean no response at all. That was a conversation that it took a lot of time, and it was, we kind of had to show our work to the city attorney's office to make sure that they had a warm fuzzy about the mitigation of any risk and liability that may come with all of that. So it's kind of an overview of what we've done in Denver. But the conversations that I have with municipalities, other cities in Colorado, elsewhere, who are interested in creating space for an alternative response or connection, whether it's 988 or some other sort of community partnership, the thing to keep in mind is you don't have to start at square 10. It doesn't have to be a alternative response program without law enforcement involvement, where calls sit on hold until one of those teams are available. It can be a clinician paired with law enforcement. I worked with one of the Mountain County sheriffs who was receiving a lot of feedback from his community, asking for an alternative response program. And he was very uncomfortable with it. You know, he had grown up in law enforcement. He knew the potential dangers that could occur on any call. And that was the perspective that he was coming from. And what I was able to do was share a perspective that I had to learn myself. And that was of a community mental health worker. When the STAR program really began to spool up, we hired a licensed clinical social worker to be the program manager. And one of the things that she brought to the table was a very different perspective from what the rest of us who had grown up in public safety, kind of our conception of what it meant to respond when somebody called for help. And she said, you know, as a community mental health worker, I've been doing this for years. I've been driving my personal vehicle to people's houses who are schizophrenic, who do have significant mental health challenges. And I've been going there by myself, sitting in their living room, helping them through things, connecting them to resources. And I didn't have anybody with me. I didn't have a radio to call for help. Doing this work as a part of the public safety infrastructure, I'm actually far safer and have more resources. I'm able to do my job better doing this now than I ever was as a community mental health worker. But I didn't have a police officer with me then. I don't necessarily need a police officer with me now. And to kind of share that perspective, it didn't, I'll tell you right now, it didn't win him over right away, right? He still was a little bit nervous, but it at least kind of opened the door for those conversations. And I can tell you that today, that program that he greenlit has progressed into something that is showing a lot of success. So when you are looking at ways to leverage the alternative options you have available as law enforcement, as 911, you can start with baby steps and then build on the successes. Start, identify a very small subset of your service calls and that don't need a physical response, and work with your 988 provider, talk about a process about how you can get those calls to them, develop that relationship, and just try it for a little bit. You will find, I know you will find success in that. It will reduce the workload on your 911 professionals, on your law enforcement professionals, on your ambulances. And it kind of starts the ball rolling of looking at a different way to approach sending people help. The final thing that I'll talk about is actually a bit of a preview for the part 2 of this conversation that's happening in July. So set your DVRs because I think it's going to be a really good conversation. Jennifer Mathis from the Department of Justice is going to be a part of that. And she's going to talk about several reports that were recently released by the Department of Justice following investigations into cities, particularly around, law enforcement response and various other things. But a big element is, how are these public safety departments supporting individuals who have a behavioral health or mental health need? And one of the conclusions that the Department of Justice has reached is when and the thing that really stuck out to me is when a 911 center has resources available, including 988, including community response programs, community nonprofits, whatever that may be, when they have those resources established and available, and they fail to adequately leverage those resources by not assessing calls effectively and just defaulting to sending police, or by not developing the policies and procedures required to leverage those resources. That is the same as discrimination under the ADA. So the conversation is shifting. When I joined the city of Denver just 4 short years ago, programs like STAR were a novelty and were kind of a nice to have, but police was still very much the default for these types of calls. And the conversation is shifting. Police is no longer the default. There is an expectation that we as public safety practitioners do the work to create the infrastructure, the resources, and the partnerships required to best serve our constituents. It's going to be an interesting conversation as it continues. I'm really looking forward to seeing where this goes and learning from some of the other practitioners around the country. I've had the pleasure of going out to Durham and meeting with the HART team. I've had the pleasure of going to Seattle and meeting with the CARES team. Albuquerque, New Mexico's Department of Community Safety is also doing some amazing things. And so there are ample resources to learn from folks who have kind of paved the way on a lot of this work. But the conclusion that I want to end with is that it is okay to start with baby steps. And 988 and a partnership with your local 988 provider is the perfect opening step into building out and taking advantage of these additional resources that exist. So thank you very much.
So thank you so much to all of our presenters for today's topic. We thank you so much for all of the information that you've provided for our participants on this, as I mentioned before, a highly requested topic. Before we get into our information exchange, where we answer questions from participants that submitted questions during registration, as well as submitted questions during through our Q&A chat function, we ask that you assist us in rating your satisfaction with not only this particular event, but the webinar series as a whole. And so if you would take some time while we're answering questions to just help us in what we can do better, if this was helpful to you at all, and if there are other things that you would like for us to talk about as we are coming up to the end of this webinar series.